Hello everybody. Today I will speak about pneumonia. Definition. Pneumonia is an infection in the alveolar spaces, also accumulation of inflammatory cells and secretions. Let's speak about pneumonia classification. Pneumonia can be classified into four types. 1. Community-acquired pneumonia, which is acquired outside the hospital. 2. Nosocomial pneumonia, which is developed more than 48 hours after the admission into a hospital or more than 14 days after a hospitalization. A special type of this nosocomial pneumonia is ventilatory-associated pneumonia. Third type is immunocompetent pneumonia, and fourth type is immunosuppressive type of pneumonia. Let's speak about typical and atypical pneumonia. Typical pneumonia is of acute onset, fever is between 38 to 40 degrees Celsius, pleuritic chest pain, cough plus minus purulent sputum, rusty sputum, and lung consolidation can be seen on a chest x-ray. The physical examination findings may include dumbness, percussion, increased tactile and vocal fremitus, and crackles can be heard. As for a typical type of pneumonia, it is a more indolent type of disease which is of non-productive cough, headache, myalgia, arthralgia, pharyngitis, rhinitis. It is common also to have chest x-ray findings without lung consolidation. What about the different etiologies of a typical and typical type of pneumonia? For the typical type of pneumonia, the etiological factors or the types can be of Streptococcus pneumonia, H. influenza, Enterobacteria, and Staphylococcus aureus. As for a typical type of pneumonia, Mycoplasma pneumonia, Chlamydia pneumonia, Legionella, and respiratory viruses. What about the value of the clinical signs in the etiologic diagnosis of community-acquired pneumonia? Different studies have shown the impossibility to distinguish between typical and atypical type of pneumonia only based on the clinical signs. Chest x-ray. The chest x-ray is the golden standard for the diagnosis and is mandatory in every high clinical suspicion case. Findings in this chest x-ray may include the presence of a new opacity. Let's speak about chest x-ray findings in a typical and typical pneumonia separately. We start with the typical type of pneumonia. The chest x-ray findings is alveolar opacities that have segmental distribution, 2. Uniform homogeneous density, 3. Limited by fissures, the opacity itself, and 4. Air bronchogram. As for the chest x-ray findings for a typical type of pneumonia, it is interstitial opacities. When compared to the typical pneumonia, it is alveolar type opacities. Let's describe these interstitial opacities. They are bilateral, not uniform involvement, and without fissure delimitation. The investigations that can be done to a patient with pneumonia include 1. Chest x-ray, and we've described the chest x-ray findings in each typical and atypical. 2. Bacteriological examination, and 3. Other tests which we will discuss later in this video. Chest x-ray is recommended, as we've mentioned, in any clinical suspicion and is important in diagnosing and to find if there is any complications which include cavitation, pleural effusions.